start. We're here with David. He's 15 months out of the LANAP, and we're just going to talk about just how he came into LANAP and the changes. And yeah, we'll start here. So, you want to just start with maybe just an introduction to who you are?
Sure, I'm Dave Bax. I'm a Las Vegas businessman. I've lived here since '82. I'm 71 years old. I've had a reasonable amount of surgical procedures, and LANAP was referred. My dentist referred me to Dr. Wong for this new procedure because I had a titanium post from an implant 30 years ago that was beginning. The bone around it was deteriorating, and she had said normally she would send me to an oral surgeon to pull it out and graft the bone and do that whole routine, which takes a long time. But she had just learned about this procedure, and I was her first referral. And so my experience with it is that first, doctor is professional. Dr. Wong is total professional. He explains things really well. He's got a really good bedside manner too. You get a feeling from him that he knows what the heck he's doing, and he's been around this gig a bit. So my experience with it so far is after going now to 2 or 3 dental cleanings since then. The hygienist has said that the gums no longer bleed when she cleans my teeth, which she said previous to the LANAP procedure. It was a reasonable amount of bleeding. And then in the last x-ray we had, which was maybe 30 or 40 days ago, it actually showed bone growth around the implant. So my experience with it is super positive so far. I would recommend it to people for those sorts of things. The expense of it was, I could afford it. It was a bit surprising. Obviously, it wasn't covered by insurance, $8,000. To me, it was worth it. I wondered about it at first. I had the choice of less money and just doing LANAP around the one tooth, but Dr. Wong educated me about the red complex and the bacteria, and that once deterioration starts in one part of the mouth, it's likely to happen elsewhere, and that doing the whole mouth then would reduce the risk of gum disease, which frankly appears to be the case with me. So altogether, my experience of it is very positive. It's a 3-hour procedure in the chair. Probably the worst part of it is just the shots, right? A couple on the roof of the mouth, which stings a little bit. But altogether, I didn't have any pain. I could sense what he was doing. Bam, bam, the laser popping or whatever, firing, or but it wasn't painful. And even afterwards, I didn't have any real pain in my mouth afterwards. It was tender. I waited a day or two before I went to real diet or certain things, but maybe a week. Other than that, positive experience for me.
That's awesome. That was great. I'm curious, like, I don't know, like my perspective of